Hello everyone, my name is Alex Bartkowiak. I am a doctor of chiropractic and the clinical director of Health HQ here in sunny Southsea. And today I want to talk to you about shoulders. Now, shoulders are probably the most common area of complaint that we see at the clinic after spine and pelvic issues, and for a number of pretty big reasons. Shoulder problems can slowly develop over a very long period of time whilst giving little to no clue that they're actually going wrong. Also, they can affect so much of what we do day to day. They are notorious for not resolving quickly, and worst of all, they're almost entirely self-inflicted. Now, that's the bad news, done and out of the way, plaster torn off, thank goodness. Now for the good news. They can get better, and we know how to help. Fortunately, we're able to help the vast majority of people who come in with shoulder problems, and those that we can't help, we can at least typically point in the direction of someone that can. One of the founding principles and fundamental tenets of Health HQ is to help people combat their symptoms by figuring out and helping them to understand why they're getting their symptoms so that they can change things for the better and get things working well, get things working right so they can feel great and don't end up unwittingly causing the same problem again. Now, when it comes to shoulder pain, unfortunately, shoulders are one of those areas where people tend to come to us and say, it just came on, or I've not done anything different. And I have to tell them that nothing in our bodies goes wrong with no good reason. Just because we don't know what the reason is, doesn't mean there isn't one. And the most common, fundamental, underpinning reason that people get shoulder problems is from what they've been doing, or more importantly, how they've been doing it. And in my experience, long-term, low-grade poor posture is the main cause of shoulder pain and dysfunction. And here is why. With good posture, our chest is up, our shoulders are back and down, and our upper arms hang loosely by our sides. When our posture is bad, the way we use our shoulders changes massively. It might not look like a big change, but from a mechanical point of view, it's a radical change that puts tremendous amount of pressure and stress on almost all of the structures in our shoulders. With poor posture, our chest drops, our shoulders come up and forward, and then to do anything in this position, our arms reach forward and our elbows lift up and out. This puts so many of the structures in and around our shoulders and upper back and neck in positions where they have to work far harder and whilst either stretched or squashed. Does that sound very comfortable to you? No, it does not. Now, if I asked you to raise your arms up and out to the side and hold them there, how long before your shoulder muscles started to feel the burn? 5 minutes? A quarter of an hour? Half an hour? An hour? Probably not quite that long. But when we use our shoulders with poor posture, this is essentially what we're doing. And if we're sat at a desk, then it's probably what we're doing sometimes for up to 8 hours a day, 5 days a week, and sometimes even more. Add in driving and cooking and cleaning and housework, and then collapsing on the sofa at the end of the day after doing all of those things, then it's astounding that our shoulders work as well as they do for as long as they do. This posture can make you more susceptible to other conditions as well, such as thoracic outlet syndrome, which is where the nerves or blood vessels that go down your arms get squashed as they pass through the front of the neck, the chest, and the shoulder. And they can cause numbness, tingling, pins and needles, or even muscle weakness in the arms or hands. Now, there is a lot we can do as chiropractors to calm down stretched or squashed or overworked muscles, but if people continue to misuse and abuse their shoulders the same way, they will never see the kind of improvements that they should. To understand why these positions are so hard on the shoulder, it helps to understand how it all fits together. Now, shoulders are a ball and socket joint, just like the hips. Two big differences between shoulders and hips, however, are: one, hips have a deep bony socket for the ball to sit in, and two, like Shakira said, hips don't lie. On the other hand, shoulders have almost no bony socket to sit in at all. All they have is a small, slightly dished portion of the shoulder blade to sit against, with the ball just through here. And worst of all, shoulders lie all the time. And I will explain what I mean by that in a second. Now, the main reason why the shoulder has almost no real socket is to allow it much greater range of motion than we get from the hips. And it works. Without that deep bony socket, we get far more movement. However, that mobility comes at the expense of quite a lot of stability. But that's where your rotator cuff muscles come in. The rotator cuff muscles are a set of four relatively small muscles whose job it is to keep the ball pulled up against that little dish, that socket, and keep the shoulder joint stable. They also help to make sure that the shoulder moves correctly. And under normal circumstances, they do an amazing job. However, we tend to unknowingly abuse them a lot. Now, you may remember that I said shoulders are liars. Well, what I mean by that is there are a lot of muscles in and around the shoulder, including the rotator cuff, that can cause referred pain to lots of other different areas, including the upper back, the neck, and even produce headaches. And we commonly see people at the clinic coming in to see us with these referred symptoms, this referred pain, sometimes having worked on these areas, the painful areas, until they're blue on the face, and sometimes with other very good health professionals as well, only to learn that where they've been feeling the symptoms, where they feel the pain, is not the area that's gone wrong. So yeah, shoulders lie all the time. Part of the reason this happens goes back to posture. When we sit supported with good posture, all the bony bits of the shoulder, the arm, the shoulder blade, and the collarbone all sit in a way that the soft tissues, their muscles, the tendons, the ligaments, etc., have space to move and aren't being squashed. When we sit with poor posture, however, our shoulders become elevated and protracted, our arms flex, abduct, and internally rotate, which overstretches some of the muscles at the back of the shoulder and shortens some of the muscles at the front. And it also closes down some of these little gaps that some of the soft tissues move through and can at the same time compress them. Ow. Now, this compression irritates, damages, and inflames the soft tissues that pass through those areas. And that on its own can cause quite a lot of pain. But imagine what happens when you move the arm with the shoulder in that position. All those compressed muscles, tendons, and ligaments have to move back and forth through those closed down areas. And if you've ever worn a piece of tight clothing or something that rubs, you know all too well how quickly and how badly things can get really irritated and inflamed and sore, and how long it can take for all those things to calm down and fully heal and repair. Now, picture that happening every time you move your arm whilst your shoulder's not sitting in the right position. Yeah, ouch. Now, this is how the process can be a factor in other conditions such as impingement syndrome or subacromial bursitis or bicipital tendonitis and rotator cuff tears. Not good if you have those things, but great if you've got the letters for them whilst you're playing Scrabble. So what can be done about these issues? Well, rest and ice and painkillers and cortisone steroid injections can all help bring down all that inflammation that's caused by the compression and the friction and the overuse and misuse, but they're not going to stop the compression or subsequent re-inflaming or re-irritation. Surgery can help fix rotator cuff muscle tears and can also remove some of the underneath of the acromion, the bone on the top of the shoulder, to create more space and help prevent that compression and impingement and inflammation and pain. But what it won't do is it won't fix your posture or the subsequent thoracic outlet syndrome that poor posture can lead to, and the subsequent pain and issues you can get in your neck, head, or upper back. And really and truly, shouldn't surgery, as incredible as it is, really be a weapon of last resort, a route to take once you've already tried things like correcting what you're doing wrong, using it properly, and not continuously upsetting it? Now, it's true that shoulder problems are renowned for not resolving overnight, and I hope you understand a little bit more now as to why. Also, you've got to remember that healing and repair doesn't happen overnight, and changing the way we sit for most of our day and how we've probably done so for most of our lives isn't going to change overnight either. And we don't really want to try and force those things to happen. Believe it or not, with the right treatment and some simple changes to certain habits, shoulders can calm down in a relatively short period of time. Getting them fully functional and working correctly takes a little bit longer. Exactly how long depends on the individual and the extent of the original issue. The way I describe this is it's a little bit like braces on your teeth. You can't just crank up your braces and wake up the next day with a perfect set of gnashes. If you try to do that, you would likely be in agony, or worse, end up breaking something. What is actually required is just sufficient, consistent pressure over time to encourage your body to readapt, to change how it works and get back to how it should be. So if you're getting shoulder problems, stop looking at just your shoulder, look at the bigger picture and get a professional to help you do that. And then that way, you are far more likely to see some improvement. Now, long-term pain in any part of your body can be very, very wearing. So I hope that this creates a little ray of light in the darkness at least. Rest, ice, painkillers can all help to manage the symptoms when used correctly in the short term, but they're not long-term strategies and they do nothing to help treat the fundamental cause. I have another video on what to do when you're in pain, and another one on how best to use heat and ice on the Health HQ website, which you may find helpful. So I'll put a link to them down in the doobly-doo. So feel free to check them out for some great tips on how to manage pain in general. I also want to reiterate the importance of good posture, and I demonstrate how to do that in my sitting comfortably video, link down in the doobly-doo. But what I really want to do is leave you with a really clever, really simple little mobilization for your shoulders that builds on the basic mobilizations that I demonstrate in my Move It or Lose It video, also on the website. All these related videos, it's almost as if it's all connected. Now, before we go through the shoulder mobilizations, it's very important to remember these are not shoulder stretches. These are shoulder mobilizations. We'll be taking your arms and shoulders through full, normal, pain-free ranges of motion, not pushing on them to try and make them go further. If you find at any point this is painful, stop and contact your chiropractor. Now, you can do these mobilizations sitting down if you feel a little bit self-conscious in the office, but standing does work better. So my advice would be find a couple of outgoing friends or colleagues, grab Karen from finance, she's always great for this kind of thing, and then get a little group together to do it as a little group. Maybe you could even start an office-wide trend. Start with your arms by your sides, knuckles out and palms facing towards your legs. Lift your chest and collarbones up, not out. There is a difference between chest out and chest up. At the same time, gently squeeze the bottom of your shoulder blades down and together. Bring your arms back behind you as far as is comfortable, hold for a beat, and then swing them up, forwards, and raise your arms up and over your head as far as you can without forcing the movement. Ideally until they are in line with your ears, or even a little bit behind if you are particularly mobile. Hold here for a moment before bringing your arms back down to your sides, and repeat a couple of times. Now, turn your palms forwards and your knuckles back, keeping your chest up and your shoulder blades down and together. Lift your arms out to the sides and all the way up over your head as far as you can comfortably. You may be able to cross your arms at the top and have your biceps touch your ears. Don't worry if you can't, just go as far as is comfortable. Little and often is far better than trying to force things. Pause a moment at the top, then back down to the starting position before repeating a couple of times. This next part can be particularly restricted and painful. If it is, remember, only go through pain-free ranges of motion. Do not push it. You are not making things better. You can upset things even more, and you will likely make things worse. If you have concerns or questions, stop and consult your chiropractor. Next, bend your elbows to 90 degrees so you look like a robot or an old action figure. And then lift your elbows out to the side so they are 90 degrees to the rest of your body and in line with your shoulders, with your fingers pointing forward. This is the starting position. From here, externally rotate your arms so that your upper arm is still at 90 degrees to your shoulder, but that now your fingertips are pointing as close to upwards as you comfortably can. You should now look like someone who's been told to surrender. From here, internally rotate your shoulder 180 degrees so that your upper arms are still pointing out sideways, but your forearms and fingers are now pointing as close to straight down as is comfortable. Repeat this a few times. Whilst doing this exercise, you should look like one of those little waving cat toys. You are also very likely to hear a lot of clicking and grinding in the shoulders. Don't worry about things being noisy, worry about things being painful. Remember, only go through these movements as far as is comfortable and don't force anything. I would recommend doing these mobilizations, ideally alongside the spinal mobilizations I go through in the Move It or Lose It video, and doing them every hour. Now that might sound like a lot, but they take seconds to go through and they get quicker the more practiced you become at them as well. And to be fair, about 4 minutes of mobilization spread across an entire day is not going to have a big negative impact on your time, but done consistently will have a very positive impact on your shoulders. And just remember, time's going to pass anyway, whether you like it or not. How we feel next week, next month, next year depends on the decisions and actions that we take now. Imagine how you'd like to feel in a month's time. Better than today? Then let's do things better than we're doing them today. Because if you do more of the same, you will get more of the same. So let's make this little change and see what we get. And that, I think, is about all you need to know for shoulders. Shoulder pain can be debilitating, but there is hope. If you have any questions or concerns, always make sure you consult your GP or your chiropractor. Otherwise, remember to keep an eye on your posture and do something nice for your shoulders. They do lots of nice things for you. But your shoulders aren't the only things doing lots of nice things for you. The whole team at Health HQ here are working hard on your behalf as well, busily beavering away to bring you all the little tips and tricks that can make your life a little bit more comfortable. So in return, please help us by hitting that like button, help you and us by hitting the subscribe button and the little dingly bell. And in the comments, tell us if you like this video or any of the other videos that we made, or if there's any videos that you would like to see us make. But in the meantime, stay safe, stay well, stay mobile, and I'll see you all soon. Bye bye bye.